Lots of conversation in Saskatchewan this week about vaccinations and the vaccine rollout plan as it changed again from the provincial government. CBC Political Affairs reporter Adam Hunter joins me now. And Adam, a lot of us could be getting our first vaccination sooner than we were expecting.
That's right, Sam. It's really a dramatic change here in the last couple of days as we've seen many different provinces decide to go to this 4-month interval between doses, and Saskatchewan announcing that on Thursday. Of course, they'd signaled that earlier in the week that they were going in that direction, but this is based on national recommendations from the Immunization Committee, all provinces signaling that they're going in this direction, and it means that people of every age over 18 that are eligible for the vaccination will get it in Saskatchewan by the end of June. This is, of course, dependent on supply, but yesterday the SHA CEO saying he expects it to ramp up fast and furious by the end of this month. We know today the Johnson & Johnson vaccine was approved in Canada, so that's the 4th now vaccine that's been approved. And this means also that population immunization will be sped up from end of September, which was the target for everyone over 18, now to the end of June. They've also moved up the phase 1 completion date because of this. And this is something yesterday that Dr. Shahab said was, very important, and the benefits being enormous, was his quote, that it's going to offer Saskatchewan a chance to get things a little more back to normal, a little sooner than expected. And he wanted also to emphasize that all vaccines will offer protection, that the 4-month interval is really a maximum, that you could get your second dose earlier than that. And that could be a reality given how many vaccines are now coming into the country over the next few months. He also said that when it's your turn, you should take whatever vaccine is offered to you, that he knows friends across the world that have gotten vaccines, all different types, and they got them when they were offered, that it's something that everyone should do when it's their turn. And of course, we know that the AstraZeneca vaccine, 15,000 doses coming to Saskatchewan in the next few days, and they will be offered to the people aged 60 to 64 because they're not yet approved in Canada for the use for people over the age of 65.
All right, Adam, and next Friday, 1 week from today, marks the 1-year anniversary of cases in Saskatchewan. At the time, I don't think we'd be a year later thinking we'd still be under public health orders like this, but the public health orders could change next week.
The Premier signaled as much, Sam, this week, and Dr. Shahab didn't dismiss it. Although the cases are still steady, hovering about 150 on a 7-day average, the hospitalizations have been dropping. The government saying that that's one of the signals that they would loosen restrictions. Premier Moe saying earlier this week that the thing he's heard the most about, that people are most concerned about and wanting to be loosened, is that household gathering rule, that you're limited to seeing people inside your house that live in your household. So that's something that I think people should look for. Some news on that potentially next week. That doesn't mean that it's going to change next week. The restrictions that we're currently under and have been under for the last number of months expire on March 19th. Otherwise, I'm not sure exactly what the government's going to go towards. There are restrictions, of course, in restaurants, retail, other venues. We could see an increase in gathering limits, but that is all going to depend on what the public health officials in the government think the risks are as far as spreading the virus, the variant risk, and also the testing and tracing, whether they're able to do that. But the signal this week from the Premier, Lee, Sam, was that they're moving in the direction of loosening some restrictions, and that could come as early as next week.
Quickly before we go, you did touch on the variant. We are testing for that locally now.
Yeah, they are testing for the variants locally. That's a new change that just happened. So not every sample, of course, gets tested or screened for a variant of concern, but the government now able to do that right here at the Roy Romanow Provincial Lab, which should mean getting the variant results sooner. We've seen a lot higher numbers of variants in provinces like Alberta and Ontario, not so much in Saskatchewan, but we may see more of those results come in as there is a couple of week lag. And as I said, they can only send so many samples away at a time. So something to keep an eye on over the next little while, and the government reminding people, because of those variants and because there are still cases circulating, that they need to follow the public health guidelines as they have been over the last few months.
Thanks so much for this, Adam.
You're welcome.
CBC Political Affairs reporter Adam Hunter in Regina tonight.